Well, welcome to ParaMOOC 2023. The official name for the course is Parapsychology Research and Education, and our topic this year is apparitions, hauntings, and poltergeists. We started our live sessions on February 28th, and they will complete on April 1st. The first thing I want to do is thank my organizational team, Brian Williams from the Psychical Research Foundation and Natasha Chisdis from Chisfilm. Both of them are from Albuquerque, New Mexico. And I also want to especially thank Lizette Coley and Anastasia Damalis, who are the president and executive director of the Parapsychology Foundation in New York. They have been supporting this course, which Carlos, my late husband, and I started in 2015. Carlos Alvarado was his name. And we have always been very lucky to have the support of the PF, and just want to say thank you guys once again. So today we have Beth Hedva. She's from the Canadian Institute for Transpersonal and Integrative Sciences in Calgary, Alberta, in Canada. The title of her talk is Doing Something About It, Clinical Parapsychology, and today is March 24th. Beth is the former director for the International Council of Psychologists, co-chair of the Canadian Institute for Transpersonal and Integrative Sciences, and a licensed psychologist and teacher. She sometimes draws on her own experience as a poltergeist agent. Yes, her husband will tell you that she still experiences spontaneous psychokinetic events that inconveniently cause myriad electrical disturbances. Her email is here, and we'll give that out to you, or you can visit her at her website, www.embodiedawareness.com. Clinical psychologists are less concerned with validating and studying the presence of anomalous events than they are with dealing with them. They focus on intervening and then resolving the crises those events cause for individuals, groups, and families. From objects spontaneously flying through the air or appearing to move of their own accord without human contact, to unusual sounds of knocking and tapping, to electrical lights turning on and off by themselves. All these seemingly ghostly displays are most often defined by parapsychologists as recurrent spontaneous psychokinesis, or RSPK. However, there is a difference between a ghost and what is popularly known to the general public and parapsychologists alike as a poltergeist. Unlike a deceased disincarnate spirit, being responsible for these perplexing, often upsetting, and outlandish events, parapsychological field research has shown that they are frequently traced to the unconscious, unexpressed, usually conflictual emotional energy of a group or an individual, often as witness, unaware of their role as an unwitting poltergeist agent. Beth's talk will outline how to blend scientific knowledge with clinical tools and conventional crisis intervention techniques, while also working with psychic energy and intuitive resources to help individuals and families alike confront their fear of the unknown in order to find new, enlightening ways to meet those most challenging circumstances.
I sure will. Thank you so much, Nan. And thank you also.
You're welcome.
Yeah. I don't think I would be here if it weren't for the two of you giving me this opportunity and invitation. And so thank you very much. And I also really want to welcome my colleagues from Haiti, Indonesia, Cambodia, India. It was great to see so many familiar names and people who I haven't seen for a long time. So thank you so much for coming and sharing today, this morning with me, or might be evening or afternoon, wherever you happen to be. I also want to thank my friends who are joining now on demand. I know that there are many people who weren't able to make this time zone, and I'm aware that you're going to be watching this without the opportunity to ask questions. So I am going to ask that if you have questions or comments, you take a moment to reflect on what brought you to wanting to come today's program to today, type it in the chat. I'm going to ask Nan for a copy of the chat, and I will respond to questions and comments on my blog, embodiedawareness.com, or you can email me at beth@integrativesciences.org, and I will also make available my PowerPoint in a PDF format if you'd like a copy of that. So just let me know. And I do want to say before we start, a little bit about my own background in parapsychology. Outside of being engaged in clinical parapsychology here at the Canadian Institute for Transpersonal and Integrative Sciences for the last 25 years, prior to that, I was also working with Lloyd Auerbach in California with the Office of Paranormal Investigations, where actually at that time I was acting as one of his expert intuitives that would join him on field research. And prior to that, way back in 1974, I started getting involved in clinical parapsychology when I was a summer study student at the Institute for Parapsychology, which was then under the direction of J.B. Rhine. I just seemed to have a real knack for helping people with their, what we call in parapsychology, psi disturbances, when they would call into the Institute, and I would kind of act as a little psychic hotline, talking with them about what they were experiencing and giving them some recommendations and suggestions. So I've been doing this work for a long time, but even prior to all of that, I was psychic as a child and had many precognitive experiences and psychic dreams. And I had my first psychic dream about making contact with somebody who had died when I was 14 years old. I had a very weird dream with a friend of my brother's, a childhood friend of my brother's, only to find out a few days later that he had actually drowned in a swimming accident. And then realized that many of my dreams from that time on were about helping people in their transitions and crossing over. And also in being able to sense and tune in and perceive subtle impressions and energies, all kinds of psychic and its experiences throughout my life. The poltergeist agent piece really started coming into play in my late teens and throughout my life. For example, I can't wear a watch because the watches tend to reflect my mood. They will speed up or slow down or completely stop. I remember when I was dating my husband, Harold, before I moved to Canada, we were in Oakland, California, going to catch the ferry. And I was so anxious about making sure that we got there on time. And there were so many things we were trying to do before we actually headed out to the ferry, and traffic was bad. And we actually ended up arriving at the ferry an hour and 15 minutes early, not late, because my watch had sped up. So you can get a sense of how these poltergeist events can be really quite disruptive, especially when, in my case, if the clock stops or slows down, then I can really be out of time. So I have since developed the capacity to sense what time it is, and I'm pretty good at that too now. I also, you have to see that RSPK, recurrent spontaneous psychokinesis, takes all kinds of forms. It also can take the form of energy transmission, what we call mind over matter, where our energy interacts with physical reality, just like my watch sped up. And I realized that I had that capacity when I was visiting my great uncle, who was in intensive care. His vital signs were just all over the map, really hard to even follow them. They were just wild. And I, in order to just comfort him, just placed my hands on him. And lo and behold, suddenly all of his vital signs just evened out. His breathing and respirations evened out. And I realized then that we have a capacity to actually transmit healing energies. Let's go to the next slide, actually, Nan. In parapsychology, it's important to start with some definitions. And I'd like to describe how we at the Canadian Institute for Transpersonal and Integrative Sciences define it. First, clinical parapsychology puts into operation insights from scientific field research. We're also guided by ethical principles formalized internationally in psychology and medicine that are part of the Department of Information and the United Nations, and also the International Union of Psychological Sciences. It's very important to attend to the clinical, cultural, and transpersonal concerns of clients. And the transpersonal includes spirituality, religious experiences, states of consciousness, all kinds of different dimensions. The other thing in clinical parapsychology, as we apply it, is we use our own intuitive and psychic resources to effect healing for our clients. Now, I think that needs a little definition too. Intuition has been defined by Carl Gustav Jung as one of four functions in consciousness, one of four functions of the psyche. We have the rational, irrational dimension of thoughts and emotional feelings. And then we have a whole non-rational dimension of physical sensations and intuitive perceptions. And intuition in particular synthesizes information and perceives the patterns by connecting the dots, and then creates insight, meaning, innovation, and creativity. Whereas psychic resources, or psi as we call it in parapsychology, it's a means of processing information. So whether it is RSPK or psi ESP experiences like energy work, healing, or inner hearing, clairaudience, gut feelings, clairsentience, inner seeing like clairvoyance, or telepathy or precognition. These are ways we process information. And then intuition puts all of the information into a pattern that gives us insight, meaning, creative opportunities, so that we can then proceed and go forward in a new way. Next slide, please. One of the things that's important when we're doing clinical parapsychology is to understand a little bit more about what the research says. After over 100 years of observing and analyzing data with these kinds of phenomena, it's been observed that RSPK agents, that again is not a ghost or a disincarnate spirit, although the effects can be very much the same. Okay, I just got a message from Nan that I can also move the slides, so that's great. Thanks, Nan. So basically, the experience of a poltergeist agent or RSPK agent can look a lot like a disincarnate spirit, where you have objects flying through the air without human contact, or rappings, tappings, and sounds, as Nan said in the beginning, reading my description. But the difference is the agent, poltergeist agent, is actually alive and well, but unaware that they are causing these events. Just like for a long time, we couldn't figure out why my watch was speeding up, stopping, and slowing down. And then I was able to understand that actually it seemed to correlate to my own internal states. What was interesting is in the research, in addition to agents being between 8 and 70 years old, so just about anybody can be a PK agent. PK is another term for psychokinesis. The median age is 14 years old, which means if most of the people are in that age range, most agents are teenagers. So what we need to understand is what is it that's going on that seems to catalyze these events. Research has shown that the onset of psychokinetic poltergeist activity seems to coincide with psychologically adverse situations. So there are also these circumstances, like for me, it was my own internal anxiety of not wanting to miss the ferry, for example, It can affect, if it's environmental or systemic, it can affect one or more members of a group. Stress from work, stress from school-related issues, grief and unresolved bereavement can also create the kind of kinetic energy that becomes psychokinetic energy. Dysfunctional household relations and marital problems also can create these effects. Then it's sometimes no longer an individual agent, but those of you who went to Jerry Selfin's program a couple weeks ago, he talks about something called an echo, anomalous, episodic, communal kinetic energies that create these kinds of impacts. It's the system itself that becomes the agent, not the individual. So we can look at that as well. The common features that we've already talked about are objects moving without human contact. According to Bill Roll, that has happened in 91% of the cases that he reviewed. Object focusing is another one, like it's mainly my watches and light bulbs. This kind of object focusing happens in 76.7% of the cases. And then I've already mentioned the symbolic representations, and the work that Lloyd Auerbach has done, and many parapsychologists and clinical parapsychologists, we notice that when we start translating the symbolic representation, and the person who is unconscious of what's going on is then able to become more conscious, then the phenomena seems to resolve, which I think is very important as well. So I'm actually going to see if I know how to do the slides. I'm going to have you do the slides for me, Nan. So if you can go to the next slide.
Yeah, because I'm sharing them. I'm the only one that can move them for you.
Okay, so great. So if you will go to the next slide, that would be great. So I want to talk a little bit about how difficult it is sometimes to tell if it's a poltergeist or a disincarnate spirit. I was invited by the Indonesian Psychology Association to develop spiritually integrated trauma recovery programs for psychologists and volunteer trauma recovery workers after the 2004 tsunami. Now, that tsunami hit off the coast of the province of Aceh. It was only 5 minutes, the earthquake that caused the 30-foot wave. It was only 5 minutes from Aceh, and 170,000 people died on that single day. And then the wave continued to affect the lives of people in 14 different countries. This was a global natural disaster, and actually is one of the deadliest, in fact, it is the deadliest natural disaster of this century, although Haiti is also another one that's the second deadliest disaster. And some of these same techniques, of course, in fact, the same training program of integrating energy and breath work and psychology and counseling were all part of what we used in Aceh, in Haiti, and in other trauma-ridden countries around the world. So in Aceh, this was a really good example of how it's hard to tell the difference. I was giving an example with one of our trainees. You see me doing hands-on healing with him. And you can see in the corner here, some of the trainees are practicing the hands-on healing with each other. We blend the hands-on healing with inner energy work plus counseling technique. And Lisa over here, my translator and co-facilitator, is holding a microphone, amplifying our voices. Suddenly, instead of our voices coming through, a very popular Achenese song about mother's love starts blaring over the loudspeaker. Now, the question is, if I am looking at this from a scientific perspective, what caused the blaring over the speaker of this song suddenly? Did the channels change? Was somebody playing with the equipment? Was there an electrical short? What happened? Let's remove all explanations that are non-paranormal, and then whatever is left, we'll explore that. As a clinical parapsychologist, I'm not so concerned about that. I'm more concerned with the phenomena itself and how it is impacting others and how they are responding and dealing with it. In this case, It could have been a poltergeist. It could have been even the trainee who had an experience that created the flip and switch. Although how it happened to be a song with his mother, with mother's love happening, is a good question, since he was specifically focusing on working with healing the loss and grief of his mother who had died during the tsunami. So that becomes a question. Is he the agent? Am I the agent? Is the whole group energy, we're all suffering from grief and trauma, could that collective energy have created something? Or it could even, which is the easiest and most obvious answer to people who are more familiar with these kinds of events, which I have to say in Asia, the paranormal is normal and the supernatural is natural. So it could have actually been a connection or a message that came from spirit, from his mother, or from some other dimension that he has loved. Next slide, please. I want to look at another case as well, where it's a little more defined that it was actually a poltergeist. During the pandemic isolation that started in March of 2020, a family in Silicon Valley began to have all kinds of paranormal events. It is very interesting to note how, amidst the chaos of the COVID lockdown, in isolation, where we're in quarantine, 3 months after the mandatory statewide at-home order was given, the family in Silicon Valley started having their phones automatically dialing 911. And then as the phenomena began to increase, they really tried very hard to figure out what was going on. The family was made up of, perhaps you can go to the next slide. Let me see, I'm not sure what the next slide is. Yeah, so the family was made up of a father who was a 56-year-old Silicon Valley engineer. I don't have photos of them for confidentiality's sake. They had within their family a stay-at-home mom who was 50 years old, also a 16-year-old son and a 14-year-old daughter. The police were called on June 17th because of the increase in activity that was very disruptive to the family, and 5 police were dispatched to the home to discover what was going on. They did what's called a welfare check on suspicious circumstances, reported that they couldn't find anything to explain the phenomena, and they recommended, having found the family credible and no evidence of fraud whatsoever, that the families try to record the phenomena itself. Well, long story short, recording the phenomena did not make the phenomena go away. The family started noticing even more dramatic intrusions. They reported having objects appearing and disappearing, moving, flying through the air, sometimes hitting a family member, unpredictable malfunctioning of electronic equipment like computers, the lights flickering on and off, car horn going, also feeling touched or poked or scratched, and scratches leaving red dermal marks on the body, also finding dog feces in the hall, and the family doesn't own a dog. And again, remember, this is lockdown. It's not like people are coming to visit with their animals. They also reported hearing all kinds of weird sounds. They eventually, through the help of a colleague of the father, who every name I use are pseudonyms, we'll call him Rob. Rob's colleague suggested they contact Lloyd Auerbach of the Paranormal Office of Investigation. And because of the lockdown, usually home visits are done to investigate these kinds of phenomena, but the isolation and quarantine restrictions didn't allow for a home visit. So Lloyd did his investigation on June 24th via teleconferencing Zoom, just like we're meeting here right now. And he came to the conclusion and helped the family understand that they didn't actually have a ghost, which is what they thought was going on, except for the engineer who was quite skeptical about all of this. But given that these phenomena were happening, they needed some help in trying to make it go away. And I have to say, people who are dealing with these kinds of events, when they're this disruptive and frightening, they don't really care so much about the research. They care more about just making the phenomena stop. So anyway, Lloyd, in order to work with this family, got a second colleague to do an investigation, Dr. Gerald Sullivan, and from Dartmouth at University of Massachusetts. And Jerry did an investigation on July 3rd, came to the same conclusion that this was an anomalous RSPK situation of a communal variety, an echo. They both decided that the family really did need some assistance. And so they contacted me up in Calgary, and I began to work with the family. I had my first initial interview with them on August 4th. Now, I want to mention, by the end of June, the family had had 76 different anomalous experiences. In July, after the second interview, by the end of the month, they had 78. In August, they actually reported that the phenomena started going down, but then there were wildfires. And any of you are familiar with the California wildfire disaster of 2020, that was a declared emergency yet again in California at the end of the month on August 19th. Suddenly, there was an increase in the RSPK activity again. The fourth member of our team is Brian Williams. And Brian is a research analyst from the Psychical Research Foundation in New Mexico. He took all of the data from our team and compared it to past research and came to the conclusion that the features of the family was reporting were characteristic of other poltergeist events. If you can go to the next slide, that would be great. And Nancy, thank you. I'd like to pause for a moment because this already is quite a bit of information, and I think it's good to process and take little breaks. So I'm wondering, Nan, if there have been any questions, or perhaps you can type your questions in the chat, and we can just take 5 minutes for some questions, comments, and reflection on anything that I've presented thus far.
The only question that we have so far is from Elaine, who said, there's a lot of parapsychology at Heritage Park in Calgary, where I have had many experiences. Have you ever done any investigative work at Heritage Park?
Heritage Park is known in Calgary to have a ghost that hangs out in the theater and other places. I haven't been invited to investigate those. I have done work in Calgary and also other places. People have come and invited me to work with them. And so, yes, but in terms of having specifically investigated the haunted places in Calgary, not as much. And Susan Gordon, I'm seeing Elaine's question. You worked at Heritage Park and you've had many RSPK circumstances at the park. So there we go. Any other comments or questions before we continue? I'm wondering if others here have had experiences or identified themselves as agents or RSPK agents. Perhaps you can just kind of notice that and put that in the chat as well. And are there any questions that I have missed, Nan, or shall we just continue going forward?
Well, Susan is asking, would you consider a poltergeist having a consciousness or an intelligence?
Well, a poltergeist is a human being who's alive and well, like you and me. So yes, they have a consciousness like you and me. How awake they are to their consciousness, that's another question. How awake are you in this moment? So the question really of a ghost, which is a very different perspective. A ghost is somebody who's not in a body, and yes, they have a consciousness as well. But when we're looking at a poltergeist, it's actually a person who is alive, who is not aware of their causing these phenomena. And the problem is they usually have a difficult time expressing themselves. So the way they express themselves is symbolically, oftentimes through these energetic manifestations of what we call poltergeist effects or poltergeist occurrences. Can a poltergeist be evil? All right, so now that's a whole different question of what is good or evil. And, depending on the culture you come from, there are different interpretations of these phenomena. There can be, from my perspective and from where I come from in my heritage, we hold the philosophical view that there really is actually only one creator, and that one creator has created everything, absolutely everything. And even the things that we call, quote, evil are part of this larger consciousness. And the purpose is perhaps to offer us an opportunity to grow and to learn and to find a way through our challenges. I'd like to suggest, when I've worked with ghosts, my own experience has been that spirits and ghosts come for one of two reasons: either to get something from us or to give something to us, to get help from us or to give help to us. And in my own experience, with just like people in our regular life, just because somebody comes to you and they want to give you something doesn't mean you have to accept it. Likewise, if they want to take something from you, doesn't mean you have to give it to them. In shamanic traditions, where they work quite a bit with issues of ghosts and not just poltergeists, but more spirits, there's the understanding of how you can work with those in a number of different ways. One is called a more masculine approach, one is a more feminine approach. The masculine approach in shamanic tradition is you command the spirits to go. The feminine approach is you do the inner work to discover what is it in you that is holding and attracting the spirit, and you strengthen yourself from the inside out so that there's no place for the spirit to attach. I tend to come more from that perspective, and that's always how I've worked with things, even before I knew there was a tradition for that. So
I always wanted to, sorry to interrupt. I just wanted to mention some of the things that people were saying about their personal experiences.
excellent.
Amy said, I had moments where I felt like somebody was holding my hand. Laura says she'd experienced flickering lights often. Susan, who asked said watches, street lights, alternators, and my pager in the old days. And nowadays I have a very awkward relationship with GPS sport watches. And Jane Anderson says, I've never been able to wear a watch and I'm very hard on computers.
Yes, I also. So yes, these are typical poltergeist or RSPK occurrences. So let's return to the conversation about poltergeist and our Silicon Valley family. And if we can go to the next slide. So in order to understand what's going on in Silicon Valley, we really need to recognize that these kinds of phenomena are not to be confused with psychosis, with dementia, things appearing or disappearing. It's not that somebody forgot where they put something. It's not to be confused with delusions or dissociation or even vandalism, because a lot of times the events, like in the Silicon Valley family, there were markings on walls and, pen on computers, scribbling on things. The bedding was also covered with food coloring and different kinds of colors. So it can look like vandalism, but these are induced by paranormal means. Now, I don't want to say that doesn't mean that some of these might not be actually contrived or perhaps created to have an effect. And that's something, as a parapsychologist, we need to evaluate. How credible is the family, what is it that's going on? Are these being staged? In this particular case, that was not the case. In fact, if we look at the impact of what was going on psychologically, then we can begin to understand the impact of COVID-19 sheltering in place is known to have a really powerful effect on children, teens, and adults, increasing irritability, anger and frustration, confusion, worry, existential uncertainty. Isolation, social isolation also creates loneliness. The pandemic also created denial and despair, not knowing how long that this was going on. So next slide, please. When we look at our family, what we need to understand is they were all dealing with all kinds of losses and all sorts of adjustments. The whole family was living in isolation under duress in a small 3-bedroom townhouse in Silicon Valley. In addition to having 2 teens at home, which those are, possible at first glance poltergeist agents, everyone was also dealing with school stress and work stress. These are typical events that can create the catalyst for poltergeist phenomena. And in addition, they were dealing with the impact of having to transition to working out of the house. So Rob ended up using his dining room table as his office. And the children were now having to do all of their schoolwork online, supervised by their mom. And certainly you can imagine that wouldn't necessarily go over real well with all teenagers, to suddenly have their mother be the proctor of their exams and classwork. In addition, the mom, Eileen, had not only her regular household duties and watching over her children's coursework, she became an events coordinator and games coordinator, trying to create an atmosphere in the home that could be entertaining and somewhat normal in the event of very abnormal circumstances. And everybody was feeling put upon with the isolation, no place for peace, no place for quiet, no place for alone time. And in particular, also the experience of the not being able to control the outcome, not knowing how long this would be happening. There were also financial stresses. For any of you who remember back to 2020, businesses were closing, finances were tight for many people. The question of whether Rob would still have a job or not, fortunately, that did not come out to play, but everybody was under much more stress. And these kinds of stresses ended up having a catalytic effect on the family. Let's go to the next slide. In working with a family in clinical parapsychology, we approach first by doing a parapsychological assessment, similar to what Lloyd or Jerry or any researcher in the field might do. And we also do a psychological assessment to see what's going on with the family. Now, in the parapsychological assessment, I want to mention, for those of you who might be interested, Lloyd Auerbach wrote a really great book called ESP Hauntings and Poltergeist. And in the back of the book, he has a series of questions that you can ask if you want to do an investigation for yourself or explore what's going on. So I recommend this book if you're interested in exploring further. I created my own questionnaire and took quite a few of the questions from Lloyd's book, as a matter of fact. Now, I want to read to you just a few of the kinds of things that were happening at the time that I was meeting with the family. Eileen actually had a background in psychology and ended up being a wonderful on-site researcher for us, keeping a really specific log with photos of things and everything that was happening. And these are some of the things that she described I sent these materials beforehand. for them to fill out before we met. So she wrote back and said, here are a few of the things that flew across the room. A pack of gum flew out of Emma's desk drawer into the hallway. Keys flew, bottle of sunscreen, a tube of face scrub, a Rubik's cube, handheld massager, sunglasses, a bowl of cereal flew off the counter and broke into several pieces on the floor, toothbrush, stuffed animals, pillow, hairbrush, bathroom scale flew up from the floor into the sink. Cordless phone flew out of its holding case onto the floor. Shirts, shorts attached to hangers flew out of the closet. These are just a few. There are more. I'm not going to read the whole list. She also talked about how the scratches and whatnot, the electrical equipment. One time when Emma was doing vacuuming, the vacuum cleaner started smoking. The car was beeping, all kinds of events, which you can see could be extremely disruptive, especially when you're locked down. And so some of the things that are really important to recognize is, how is the family prior to all of these events? And so in addition to doing a parapsychological assessment, they also filled out the Los Angeles Symptoms Checklist, which is a 43 self-report item checklist to assess anxiety, depression, adjustment problems, and global anxiety, acute, and post-traumatic stress. Now, what's interesting is that in this family, at the time that they took this test in August, both the parents came out having subclinical scores for acute trauma. They actually did have indications of anxiety and adjustment problems. And they also, I should mention, one of the other things that's really important whenever you're doing any kind of work, it's very important to have consents. So this family also sent in consents for treatment, video treatment, as well as to participate in research. And they returned all of that. Because the children were minors, we didn't need to have consents from the children, and the parents reported what they observed about their children's mental health. They said that Nathan, the 16-year-old son, had no history of mental health concerns other than reactions to the RSPK, while Emma had been treated for generalized anxiety at the summer of 2019 before the pandemic hit. She was treated with cognitive behavioral therapy and was on SSRI medication, Zoloft, at the time that we actually were meeting with each other. Now, it's interesting, Eileen made comments that according to Eileen and Robert, the CBT therapy did not work for her. She never went in with the mindset that it would help. And she also gave the example that Emma was diagnosed with scoliosis a couple of years earlier and was anxious about having to go for surgery after she was having to wear a brace for a couple of years. She did not actually end up going for surgery and was out of the brace by the time I was working with her. But this tendency towards anticipatory anxiety was already part of Emma's history. She also claimed that her two biggest fears were spiders and doctors. And then Eileen mentioned that because she was afraid of doctors, that's probably why she didn't want to talk with me. I should mention, Emma came to absolutely none of the treatments, and Nathan refused to come to the initial session on August 4th. Now, in family therapy, we proceed regardless because we come to working with families from a systemic approach. And research has shown that even if one member of the family changes, the whole system changes. And so we were able to proceed with the therapy with actually very good effect. The other assessment that I did was something called adverse childhood experiences. The ACEs is something that was created by Kaiser Permanente. And it is a 10-item self-report checklist to assess a history of trauma, whether there was suicide or death in the family. There are 10 very specific items, financial stresses. And both Eileen and Rob had a score of 0, which indicates that there was no history of trauma in this family. Although there was a history of anxiety. Apparently, Eileen's sister was also taking SSRI medications. So there's a question of whether anxiety might be also inherited, and that might be part of what was going on for Emma. But I do need to say, there's also research that shows that highly sensitive persons are also prone towards depression and anxiety. And so I suggested that Eileen and Emma fill out the highly sensitive person checklist, which is a 27-item true-false questionnaire to assess the individual degree of sensitivity to sensory stimulation and overload. And interestingly enough, both Eileen and Emma, and actually Eileen's sister took the test too, all tested as positive HSP, and they also all claim to have psychic sensitivity and some ESP. So there's a need for more research in that regard, I think, to identify whether there are inherited tendencies when it comes to things like poltergeist, and also whether sensitivity, psychic sensitivity and sensory sensitivity are at all related. Let's go to the next slide, please. In working with the family when we met on August 4th, and as I mentioned before, they only came as the marital dyad. The teenagers chose not to come. I sat down with the parents via video conference, and we assessed together what it was that was going on. The first thing that I think was probably the most helpful for them was looking at the list of the many things that they had been suffering through and organizing it into clusters of meaningful categories. So there were those categories that had to do with cleansing and hygiene and body image and food and junk food and entertainment and games, all of those, and then of course the telephones having to deal with communication, all of these different categories, things that had to deal with school, like the computers and study materials. So when we were able to start categorizing and organizing, we could begin to reduce the fear that maybe there was a meaning behind some of these events. And if there was a way of bringing into conscious awareness what this was about at another level, then maybe things could begin to resolve. With the phones and the 911, it was a clear indication that the family really was in a state of emergency. And the symbol of a phone is also about communication. So we talked a bit about also, based on what it was that was going on and when these events happened, it looked as though they were related to frustration, irritability, power struggles, and interpersonal conflicts. So the question of how to reduce stress with conventional crisis intervention stress reduction strategies, breath work and energy work, mindful awareness, also constructing relaxation rituals based on the things that they were already doing, how to create their own rituals. Rob enjoyed playing guitar, doing artwork, playing games as a family, doing things in solitary to be able to soothe and calm oneself, movement and physical exercises like yoga or taking walks. So all of these kinds of stress reduction strategies were then designed as part of homework for the couple and for them to introduce these to the family. We also suggested that they continue keeping the RSPK log of incidents to actually enhance the mindful awareness by identifying what happened, who witnessed it, when it happened, under what circumstances, and also any beliefs about why it was happening, if there might be a possible symbolic representation. Likewise, I recommended a number of resources, books, YouTube videos on psychokinesis. And with this group of strategies, Rob and Eileen felt quite confident that they were going to be able to handle things. They chose not to continue therapy at that time. I told them that I would be available to them on an on-call basis. And they said that if they needed help in the future, they would circle back in September when school started again. Well, unfortunately, there was another crisis in California, which I mentioned before. Around the 16th of August, 10 or 11,000 freak lightning strikes started fires throughout the state of California. And by the 19th of August, the governor declared a natural disaster, wildfire disaster in California that it continued all the way through the end of the year. But by August, for this family, they were beginning to have a few more events happening. I was concerned about that, so I reached out to the family on August 19th to see how things were going. This was 2 weeks after we met initially, and this is the letter that Eileen shared. I think weird things have happened a total of 4 days since we talked to you. 4 out of 15 days is not too bad for us. And it was never an out of control night as we had experienced in the past. It always happens right after there's been a conflict or a voice has been raised. For example, after Emma and Nathan fought about Nathan not helping Emma with school email issue, Nathan's laptop disappeared. Rob got frustrated one day and his phone then dialed 911 twice. So everything that happens makes sense. However, by August 26th, until the end of the month, August 30th, the family suddenly began experiencing an increase in RSPK occurrences, a total of 44 occurrences by the last week of August. And then the family chose to come back to therapy for weekly therapy starting September 14th. Next slide, please. So I want to just review the treatment and the events that happened. I worked with the family until March. Starting in June, after the first scientific investigation, by the end of the month, there were 76 different events logged. In July, with the second investigation, events went up to 78. In August, they went down, but then with the increased environmental stress of the fires and smoke and needing to be locked down again in September, events went up to 74. In September, once they started treatment, they began to go down again after treatment. There were, by the end of the month, only 28 events. October, the events went down to 20. By November, at the end of the month, there were only 5 RSPK occurrences the whole month, and the family chose to transition to every other week bi-monthly therapy in December. December, they kind of held their own. There were only 4 events, although there was some stress around the holiday season. And that combined with going back to school, and as you might recall, the insurrection, the attack on the US Capitol on January 6th, suddenly there was a spike again in occurrences on the 27 occurrences by the end of the month. And then there were more occurrences, another spike that seemed to be associated with school stress and performance anxiety for the teens. Nathan was preparing for his college entrance exams, and Emma got into a tremendous power struggle with her mom about her mom managing her, whether she was paying attention or not to her schoolwork on the computer. So that last event actually blew up into a number of, damage really to the parents' bedroom, a little bit to Nathan's room, and only one thing in Emma's room. However, it was very interesting. On February 3rd, when everything blew up, Emma had a vision, which is something that she would often be able to do. She would see numbers in her mind and be able to predict, for example, how many cookies were in a bag of cookies. Or she would also be able to predict things with cards and whatnot. She then saw on the day at the end of all of the final blow up, in white letters in her mind's eye, the word DONE, which of course, as we know, spells done. So she reported to her parents that the RSPK events were done. They didn't need to go to therapy anymore. Everything was copacetic. Now, of course, Rob and Eileen were not so convinced because they had gone for periods where there hadn't been much activity. And so when we met again, I asked them how long did they think they needed to go without any activity to feel like things had really ended. And they thought it would take about a month. So after 35 days of no activity, we terminated our therapy. And in fact, that prediction was accurate. The intensity of those RSPK occurrences did in fact subside at that time. Next slide, please, Nan. Again, I want to take a short break and just see if there's anything that is in the chat that we might want to address before we continue actually looking at the specific interventions that we used to deal with those spikes of activity, and also what you can do if you're working with people who are dealing with these kinds of phenomena, or if you happen to be having these experiences yourself. So, Nan, are there any questions or comments that you could share?
Yeah, there's a number of them going back to when you moved into the next period of giving us details. At that point, Elaine was asking, how do you tell whether it's a poltergeist or a resident ghost? She was talking about the Heritage Park Prince house that has no electricity and yet has lights in the attic.
Right, and we addressed that in the last section. Let's just keep going.
Okay. From there, Dr. Ahmed said, is it common that we come across sometimes extraordinary spiritual dreams or ideas that may come true without any physical reason, or healings or sickness experiences even?
That is a wonderful topic. Psychic dreams and psychic dreaming and dream incubation, where we can actually program to access these expanded states of consciousness for healing, and also to receive guidance and information. But that's another topic that we're not going to be focusing on.
Right, definitely. And then Bernadine was asking, what is the limit between a mystical or a spiritual experience, and when you need to worry about there being something psychotic or psychopathological?
Now, that's a really important question. And Vernon Neppy, who's a parapsychologist from South Africa, psychiatrist as well, living now I think he's on the Northwest Pacific coast, Washington or Oregon, I don't remember where he is right now. He observed that psychosis and delusions are often self-referential, and they have a way of enhancing or increasing one's ego or diminishing one's ego. So if you're getting guidance about, how you are the most amazing person in the world, in fact, you're God incarnate now and you're the next coming, well, there's a good chance that's a delusion. Or if it says you're absolutely worthless and there's nothing in you, you're nothing and you should just, hide away, or, you're ineffective in being able to do anything, the inner voice of the critic. then that also most likely is delusional. When we're looking at psychic and spiritual phenomena, there is more of this non-attached. Simply, it's informative, it's clear, it's information that is perhaps offering guidance or support, but not necessarily about boosting your ego or diminishing your sense of self. That would be just a quick thumbnail of some of the things that Vernon Neppy talks about. And what's
that's it. I'm sorry.
Yeah, no, that's it. Is there another question?
Okay. I was going to say, Amy, who has had to leave, had asked about demonic possession. And rather than get into that, though, what that reminded me of is that when we were talking in one of the other field investigation presentations that we've had so far in the course, this idea that and you often have to kind of get across or get over the barrier of the people that are involved in the experiences blaming anything and everything else, and not really turning inward and understanding how it might be something that's coming from them or something that's coming from their situational experience. And how did you help these guys kind of move through that understanding of what was happening to them?
Good. So that's what my next section is about, as specifically, what are the interventions to help that? You also bring up another really important point about psychosis and delusions. They're not only self-referential, but people who are in a psychotic state have a very difficult time being self-reflective. It's very hard for them to look at themselves from an objective point of view. And that's another indicator, versus most of us do have the ability to self-reflect, to take a moment to look within and to determine what we're thinking, what we're feeling, what are the circumstances that might be activating or triggering certain kinds of thoughts or feelings. When somebody is in a psychotic state, they have a very difficult time doing that. So let's go on to the interventions now, and let's continue. So my primary form of intervention, in addition to all of the crisis strategies, crisis intervention strategies, which we continued throughout the therapy, how important it is to continue breathing, to continue working with oneself with relaxation rituals. All of those were included throughout the therapy. But in addition, we then began to add in additional treatment interventions to help the family. Emma still refused to come to therapy, and Nathan came for between 10 and 20 minutes per session. So the first thing that I always like to offer is to train my clients to become self-aware, self-observing, using embodied awareness, to be able to trace and track the energy in the quality of their thoughts. So are their thoughts spinning, or is their mind clear and calm? In the sensations or felt sense in the body, to be able to trace and track the energy in their emotions and their intuitive feelings and perceptions. And in being able to then begin to have awareness of the sensations in the body that often then will blossom into emotional feelings that are associated with particular thoughts, we can then begin to engage all of our senses, what it is we see, hear, touch, experience, and to begin to confirm our intuition from those and normalize our experiences, including those intuitive awarenesses, our gut feelings and hunches, or those telepathic experiences, which in psychology we call empathy, where we have a sense of what somebody else is feeling, and any number of other sensitivities. When we're able to listen to ourselves with our whole body, heart, and soul, and then be able to listen to another giving them that same kind of attention, listening to them with our body, heart, and soul, we're able to have a different quality of communication. Next slide. So improving communication and conflict resolution skills was primary for this family, as symbolized with the 911 dialing of the phones, for example. What we ended up finding is training the parents to be able to identify and verbally share their own thoughts, feelings, and needs was a first step. And then, of course, with Nathan as well, when he would come to our sessions for those brief moments, 10 to 20 minutes, it's not always enough time to go all the way through some of these exercises. To help the family with that, I provided them with a handout of a vocabulary of sensations and feelings so they could access then their intuitive perceptions to allow for clarification and discussion of their inner experiences and to gain insight and understanding into each other's and their children's experiences. They learned how to listen, to acknowledge, appreciate, and empathize, as well as confirm each other's needs. Every single one of us has a need to feel seen, heard, understood, and confirmed. And in that empathizing, going to a deeper level of listening and being able to put words to the unspoken message that their partner or their children might be feeling, and also then sharing those hunches, but checking out if they're making assumptions that aren't accurate or true. And then once everybody is clear on what it is that everybody needs, to develop win-win negotiation styles versus forced choice or win-lose. Now, this capacity to be able to work with themselves and each other and coaching them on how to express deeper need, the parents then became coaches for their children as well, as they themselves were better able to expand their awareness and maybe even expand into greater extrasensory perception. Next slide. Now, I have to say, this was a big stretch for Rob. I mean, with his engineering and mathematical background, very concrete, logical thinker. And we did talk about what's happening now in quantum physics and the different kinds of perspectives from parapsychology that could help him perhaps begin to wrap his logical mind around some of these things. And that was helpful to him. And I found out, actually, I met with the family for the first time face-to-face, the parents, when I was down in California last fall, and found out that Rob was actually taking a class on quantum physics, which I think is just wonderful. Oh, and I also want to mention, I found out that Emma has decided that she might actually like to become a psychologist. So I think there was wisdom for her being able to have an internal locus of control in choosing, under the circumstances of the pandemic when she was out of control of so much, to be able to have control over whether she came or didn't come to the sessions. And it could very well be that Emma then, as one of these very sensitive individuals and part of the future potentially of psychology or whatever it is she chooses to do, will come up with some new innovative ways of how we can actually help ourselves and each other. But anyway, that's a future vision for Emma down the line. In dealing with the family when they were under crisis, another really important piece for this family in particular was, because of the pandemic isolation and because there was so much extra intensity in the home with having to manage everyone and everything that was going on, the couple ended up having what I would call situational distance. They were not necessarily disengaged from each other, generally speaking, prior to the pandemic. But during the pandemic, they were having a hard time finding time to connect with each other. So doing emotional intimacy exercises and physical intimacy and affection exercises are important. building on family strengths is always important when we're dealing with crises. So I provided the mom and dad with a way to address issues by asking them, reflecting on themselves and asking each other and sharing these 4 questions. First, by doing a body scan and just noticing where they are, how they're feeling, what their thoughts are, any sensations, and then to be able to share with each other. One thing you did or said recently that I appreciated is, and then sharing that with their partner. One recent moment when I felt extra positive about you or our relationship is. And then third, here are some of the main things that are occupying my mind today, or main things that I'll be doing today. And then the last, one small thing I did recently that I hope made you feel at least a little bit cared for is. And I want to recommend you take a screenshot of that because these 4 questions are remarkable in rebuilding a sense of connection to our important primary partners. And we also did these kinds of questions with Nathan as well, to be able to share how we're thinking about each other and how we are adding benefit to each other's lives and how we appreciate what others are doing for us. So in addition to the emotional intimacy questions, we also recommended, once especially the isolation was easing and people were able to take walks in a bubble or be outdoors, that the parents take walks together so they could have some private time without the kids around. And also to be able to share physical touch, including massage, for example, which is such a simple little exercise, and other bedtime rituals that were appropriate. I know Rob actually suggested, and they created their own homework at the end of sessions, as well as the homework that I suggested. They were very proactive. They really wanted the phenomena to stop. So they were doing everything possible to make sure that that would happen for them. So he wrote out these questions, used it as a bookmark, and then as part of their nighttime rituals, they would review these questions with each other. Next slide, please. Nan? It looks like.
I'm showing the next
I'm
slide.
sorry. Yes.
Yeah, not to worry. Sometimes it takes a while to resolve.
Oh, very good. Thank you. Sorry about that. So, yeah, so the next that was really important was, as things progressed, the trauma of the shock of these events that were totally outside of their control, even though the events were going down, the memory of the events from the fall, from the spring, when they were so radical, were still plaguing, particularly Rob. And so we have to address the post-traumatic stress. And we used, obviously, some of those crisis intervention techniques, breath work, relaxation rituals. The energy of breathing is also very potent in reducing stress. But in particular, we also used bilateral stimulation. We used the tapping technique, which is part of the EMDR, or eye movement desensitization reprocessing. And there is evidence that EMDR, or any form of bilateral stimulation, is very effective for some patients in helping them reduce the trauma of the past and actually put it behind them, instead of constantly being re-triggered, feeling like it's happening again now. Next slide. Also, it was very important in this family to work with the cultural, transpersonal, spiritual, and religious elements. This is important in any case, but in this family, it was as though there were 3 religions being practiced under one roof. Even though they shared a common religion, they had very different practices. The parents had a more a modern conservative approach to their religious practice. Their son actually chose a more orthodox practice. And then their daughter, Emma, decided that she was an atheist and didn't want to have anything to do with the practices. So finding a way of understanding if one's cultural practices and how they're being expressed in the family, if this is helping or hindering the resolution of RSPK. In this family, unfortunately, the religious practices created more conflict and power struggles, which of course fueled RSPK activity. It was also important, as I mentioned before, to train the parents to model and coach their children on how to use these good communication skills, sharing their capacity to give compliments, to be able to openly share honestly gripes and compliments. And it was interesting to note, and this is what I love about family therapy. In the beginning, I remember the parents reporting that Emma was very suspicious after sessions when they would start giving compliments. And she said at one of the dinners in family, you know, Beth is asking you to do that. And she kind of refused to be engaged. But then a few weeks later, actually, Emma suggested, let's all give each other compliments. So, you know, things do make a difference and seep through, even if all family members are not able to attend or engage in the therapy itself. If one person changes, the whole system changes. It's important to remember that. The other thing that was important in this case was to educate the parents about teenage development and to really encourage them to help their children develop their own personal identities, which they were very good at doing in terms of creating space for their son to be more orthodox, their daughter to explore being atheistic, and to be able to develop that internal locus of control, which is so much what teens need to do. Next page, please. Yeah, so on this slide, this is wonderful. So Brian Williams did an analysis on, it looks like we're missing the top of this slide because our names, at least on my screen, are covering the description. So I will simply describe it. Between June 17th and the February 3rd, but things ended on February 4th, things were completely done. There were 295 occurrences. 240 of them happened between June and September 14th. So most of them happened, as you can see, prior to starting therapy. Once therapy began, the frequency of the occurrences began to decrease. And in fact, the daily recorded disturbances significantly correlated with the delivery of family therapy services to the degree of 0.001 two-tailed, culminating in the cessation of the disturbances on February 4th. There were some spikes in which there were more than 5 occurrences in one day. That's how we measured a spike. And they correlated with the fires and smoke of the California wildfire disaster, where they had to be closed in their house again without even the windows open because the smoke was so noxious. There were also, as I mentioned, around the beginning of January, with the insurrection and riots and the stress of the holidays and going back to school. And then again, over here, there's another peak that had to do with the experience of school stress for the family. Next slide, please. You know, there was a slide here that was missing once again, Nan. It was a slide of the different kinds of occurrences. And what, yeah, it's way back and we're not going to see it. I think it must have been one of those there it is, the object focusing. I must have missed this one. So I want to talk a little bit about this. The impact and what we found in the research of the family when we started analyzing the data. There were the typical kinds of characteristics of poltergeist phenomena. There were 40 incidents of the cell phones auto-dialing 911. I think it's really significant to notice how there's both the symbolic clustering and the object focusing. There also was an experience of the 41 food items. And I think that this is interesting too, because during the pandemic, many teens and especially adolescent girls were very concerned about gaining weight during the pandemic. And 40% of the items in this case were junk food: candy, bread, donuts, chicken McNuggets, lemonade, and more. In addition to that, Emma had expressed concerns about whether she was gaining weight or whether she was fat. So this was a concern for her personally as well. Also, the symbolic level of food issues, with the food appearing and disappearing. It could be also related to emotions. Emotions being overwhelming and appearing, emotions wanting to stuff them, or emotions just wanting them to disappear. All of those kind of symbolic references can be associated with food. And then, of course, there were 47 incidents of cleansing and hygiene. And whether it was soap and water or shampoo, conditioner, face scrub, antibacterial gel, toothbrushes, all kinds of other hygiene-related items. This obviously seems to have resonance with living during a pandemic when there was no cure, no vaccines, no way of staving it off other than isolation, wearing masks, and using good hygiene and antibacterial gel to prevent possibly catching the virus. So cleansing and hygiene could be related to that, could also be related to the teenage concerns around body image. And we, again, do have two teens in the house, 16-year-old Nathan and 14-year-old Emma. So again, now let's look at the implications of, now that we know that clinical parapsychological treatment does make a difference when dealing with something like poltergeist, which is the unexpressed, usually conflictual, emotional energy of a person or a group that's dealing with all kinds of stressful circumstances. What this implies is there is, in fact, a need for clinical parapsychology. The need is obvious, especially when we recognize that 70% of men and 81% of women in Iceland report that they have some kind of psychic experience. In addition, based on the reports of Australian Institute of Parapsychology, 90% of 4,000 self-selected individuals who filled out an internet survey from 60 different countries reported that they had at least one type of paranormal encounter. And in addition to that, the Asian Journal of Public Opinion Research said that there has been a steady trend in more people believing in clairvoyance. And so what this all implies is that those individuals, some of them may actually be in need of help and intervention from clinical parapsychologists, particularly when we look at the long-term impact of the pandemic. What research has shown is that the long-term impact of social isolation, which all of us suffered through that, is known to impact teens and children for up to 9 years afterwards. And that the collective stressors of the pandemic and pandemic isolation can have a significant impact on otherwise healthy families. Even in this family, it produced defensive RSPK reactions. I also want to mention that the increase in gun violence that is so prevalent right now, in addition to climate anxiety and political anxieties, has had a huge impact on teens. And in particular, prior to the pandemic, as I can't remember if I mentioned this, but Emma really was in good company. She joined the ranks of 1 in 3 teens prior to the epidemic, the pandemic, who reported generalized anxiety. And after the pandemic, anxiety rose to 143% for teens. I mean, that's a ridiculous amount of increase in anxiety that was due to the pandemic and social isolation. So it's very possible that the after effects of the pandemic may include many kinds of stresses, including the possibility of paranormal phenomena and paranormal activity. Another thing that's important to recognize is that those who are dealing with psi disturbances really only want the phenomena to stop. When it's a psi disturbance that's upsetting their day-to-day habits and routines, they're less concerned with the research or how or why. They just want it to go away, and we need to pay attention to that. Researchers in parapsychology are sometimes fascinated with the phenomena itself, but that fascination is not necessarily going to be what helps a family in distress. The field study of psi phenomena, we learned here from looking at the data, is actually insufficient in helping to quell the disturbances. June disturbances were at 76. After 2 parapsychological investigations, the disturbances continued to go up. It was only after using clinical interventions and support that the disturbances started going down. Next slide. So in conclusion, what we can say is psychic phenomena, exceptional experiences, and anomalous psi disturbances require professional parapsychological research and practice. Investigating the phenomena is really only a small part of clinical practice. There is an obvious need to build upon the practice of clinical parapsychology, and in my opinion, it should be a professional division in the Parapsychological Association. And for those of us who are involved in other professional associations, psychology, counseling, other helping professions, it would be wonderful for us to lobby for creating divisions within psychology for parapsychology or clinical parapsychology. And finally, we also need to include that awareness that before the pandemic, we weren't so sure of this, but now it's obvious. Remote communication technologies can provide an effective venue, especially for collaborative work among researchers, investigators, clinical parapsychologists, healers, psychics, as well as clients. And in our case, we had me in Canada, Jerry in Massachusetts, Brian in New Mexico, and Lloyd in California, where the family was located. And it was because of the remote technology, we were able to draw together our resources. And this could really bode well for clinical parapsychology in the future, because oftentimes people who are in need of assistance may not be near a local center where they can get this kind of help and drive to see a therapist for help, if they're in rural environments, for example. But if they have internet, we may be able to be of assistance. So I really thank you. Next slide, please. I want to thank you for your kind attention. I do have a few resources here that I know you can't read because they're teeny, but we can make available the PDF. If you'll go to the next slide, one more slide, you can reach me at beth@integrativesciences.org or visit my blog, embodiedawareness.com, or you can reach out to me on WhatsApp at my WhatsApp number, 1-403 585-5805. And now we have some time for some questions and conversation and discussion.
Thank you so much. This was really interesting and really detailed. And if with your permission, we'll put your resources up on the materials page in the website. It's a very interesting and very systematic kind of look at what the families need. Now, there's a couple of questions here. One was from Isha, who wanted to know at the very beginning, I mean, obviously with the clinical practice that you put through and what happened to the family as a result of their therapeutic experience, you made the right decision about what was going on in that event. But Isha was asking at the very beginning, were any of those experiences that they were reporting, could they have been anxiety related hallucinations rather than something more objective?
It was not an anxiety related hallucination. There was no evidence in this family of any hallucinations or delusions. That's why I particularly went through the ACEs, which looks at trauma and trauma reactions, and also the Los Angeles Symptoms Checklist, based on meeting with the family and interviewing the family and also meeting with the son. Their reactions were typical anxiety reactions, not hallucinatory and not delusional and not psychotic.
Yeah, that's how it sounded to me, but I'm not a clinician. There was some interest among the field investigators that are on this call of how to get a hold of the high sensitivity Aaron's questionnaire, because it's sort of I'm assuming it sounded like something that's really good for them to also include in even a ghost and haunting kind of experience.
Yeah, it's hsperson.org. And I'm going to just double check, and I'm going to pop it up to make sure that that's the correct URL. hsperson.com, maybe.
And you can pop it into the chat if you've got it right there.
Yeah, that's wrong though. It's hsperson.com.
Okay.
Yeah, that's why I just popped it up online. So forget that. If there's a way of deleting it, it's correction, hsperson.com.
Well, not to worry. We'll have Brian find it and we'll put it in the newsletter. There was another comment that Susan made. She works with horses, and many of them are quite traumatized, and she found that tapping and light therapy offers a tremendous amount of relief, along with compassionate training. And she wondered if you'd ever worked with an equine assisted mental health provider for those that are traumatized by RSPK.
Not for RSPK. I have a colleague who is part of my circle who is engaged in equine therapy. I think she registered for this, but she might not be here today because of the times that this is being offered.
One of my nieces is an equine psychologist also. Can we take down the PowerPoint at this point? Yeah. Okay, let's do that. And then if anybody would like to turn on their video, I think we're okay. We're down to about 28 people, so that should be fine. And if not, go ahead and put your questions, hi Susan, into the chat.
Right. I want to thank Ingrid, who is really good with research figures and numbers, for doing the math for us. Anxiety went from 1 in 3 to about half, just under 1 in 2 with anxiety after the pandemic.
Yeah, I'm sorry I missed that. I was going to mention that. That really shows how much of an impact the pandemic had. Yeah,
absolutely.
Susan, did you have something to say?
Hi, it's Heymana. How are you?
Oh,
Can you
hi,
hear me?
Mana. Right. I saw that in the chat. I'm so
Yes,
sorry.
that's okay. Good morning. So I wanted to know if you intuitively, when you come in there, because I do some, I guess you call rescue mediumship, I don't know, but can you
Yeah.
intuitively tell if it's a poltergeist?
Yeah.
Or do you have to research? I mean, I'm sure you research to get a
Yeah,
clinical.
you just ask a few questions, so there are those criteria that you can look at. The biggest one is, are they under some kind of duress?
Okay.
Are there marital problems? Are there school issues? Are there power struggles in the family? Are there financial issues? Has somebody in deep grief because of some kind of loss? And it doesn't necessarily have to be due to death. I mean, you could have lost your job, for example. So if that's happening, and then add to that, is there a teenager that's in the family? Somebody between, let's say, 12 and 20,
I get.
then
Thank you.
it might be that it's not a ghost. It might be
Right.
that it's actually a poltergeist instead. It might be the system or the family, or it might be, an individual.
This
Or,
is very helpful.
yeah. And
Thank
frankly,
you.
there's another level too. And it's so nice to see you, Heymana.
It's good to see you. Yeah.
So there's another piece in here too that I didn't talk about in this particularly, but there's also the archetypal level. When we look at what's happening in our world right now, that these kinds of events, the psychic trauma and intensity that is impacting us, something like the pandemic, which is confronting us with death, is also an opportunity for renewal and rebirth, for change and growth.
Right.
And if we look from the Jungian perspective, there are very large forces, like the force of the archetype of transformation or death and rebirth. And then on a very common societal level, we're experiencing all kinds of deaths and rebirths, the wildfires, climate change, the pandemic, economic crashes and boosts and booms, all kinds of challenges. That energy infiltrated the family system that created stress for the family.
Okay.
And then, of course, the stress in the family could be creating stress for an individual in the family, hence a poltergeist. So is it archetypal? Is it coming from society or the collective? Is it coming from the stress in the family? Is all of that possibly true and being filtered through maybe a sensitive individual who's acting out the stress psychically and symbolically?
Thank you.
What I lean towards. That's what I think.
Yes. And hopefully I see you soon.
Yeah, ditto. I look
Okay.
forward to it.
All right. Thank you. It was really wonderful.
Yeah, thank you.
Jane Anderson from Port City Paranormal just said something like this should be the part of the initial questionnaire for all field investigations, no matter what they are, or what they look like at the beginning.
Yes, I think that would be helpful. And I'm beginning to actually send my parapsychology questionnaire to my regular clients too.
Wonderful idea.
Yeah, because a lot of people are having these experiences. I just got a questionnaire back from a person last week who's dealing with, she came in with a non-parapsychological issue, dealing with hoarding and whatever. And her personal experience has included, drawers opening and closing on their own, which I thought was kind of interesting, So, and other parapsychological psychokinetic effects that if I had asked, I wouldn't have asked as a psychologist, right? So I think it might be interesting just to kind of include some of these questions in our regular.
Yeah, it gives you exactly. It gives you a baseline, and it also gives a safer way for the experiencer to mention these things without feeling like maybe this is something paranormal that they don't want to talk about. It's just part of a general kind of questionnaire. I think that's a great idea. I love the idea of I don't know how we would do it, but I love the idea of lobbying the Parapsychological Association or the scientific, the Society for Scientific Exploration for a clinical parapsychology division. There's certainly a lot of people in Europe that have been working quite for a number of years on this from that point of view. In fact, I was thinking that this may be a really good topic for one of our upcoming paramoocs in the future, is to have it focus on clinical parapsychology. I know, for instance, Walter von Lukudu at the IGPP in Freiburg, their clinic has been going for, I don't know, 30, 40 years, right? Lots and lots of experience and lots of techniques. We had, when we were in Utrecht in 2008 for that conference with the Parapsychology Foundation, we had a number of people from that group who were talking about clinical stuff, and definitely it was a conversation over dinner and those kinds of things because of the number of people who were having that as part of their practice. So it's a really important thing, I think, and it's not as foregrounded as it should be, probably. So I think this is once again, I have to say that Brian did a great job getting our presenters, because this is a really really interesting and grounded way of looking at everything, as well as a deep dive into a single case, which always makes everything more understandable and more it gives you a bigger sense of what people are going through and how they have to manage what they're going to say and what they're going to not say, and so on.
Right. There's one thing I also want to add to that. There's this belief in the psychology community, particularly Western psychology, that is always looking for what's wrong in pathology.
Yes.
And that is not the point of view that I come from.
Exactly.
These anxiety reactions are normal reactions. That's first and foremost. And second of all, when somebody is under stress and crisis, we build on their strengths. We're not trying to pathologize them. We want to really support them in finding a way to integrate and develop their capacity to respond to life stress and, in fact, use their own psychic and intuitive capacities if that is an access to them and an asset for them. So, I think that clinical parapsychology has something to offer beyond where Western psychology is. And I want to confirm in Asia and in Africa and in Haiti, where I was doing recovery work, and in indigenous cultures in North and South America, these kinds of events are normal, not paranormal. And I think there's something about us having to recognize and get over our intellectual racism that's part of the Western worldview, and begin to adopt and accept and embrace other psychologies and methods of healing. So I just, that's a passion point for me.
Well, I think that's such a good way of putting it. And there's so many ways of looking at the world, and so many, and frequently the way the Western ethos goes, you end up taking perfectly okay people and pushing them into being anxious, angry, upset, unable to test reality anymore, and completely surrendering to this sense of, okay, I'm crazy, when that's not what's happening. That's what that whole focus on psychopathology does to people. I teach multicultural psychology and positive psychology at National University in San Diego online. And I was talking to one of my graduate students recently, and he was mentioning that he had decided not to be a clinical psychologist because of diagnosis, that it was so easy to get into that place where you come up with something that fits sort of, and then you drop that on the heads of individuals, and is it or is it not? And I had to admit to him that that was one of the reasons why I was interested in doing sort of psychological surveys as opposed to being a clinician, because I had seen that happen to people that we knew around us in Chicago. We had a little parapsychology group when I was an undergraduate. Brenda Dunn was at my college, and our professor was very interested and so on, and did some work for a while. And there were people who came to our events who would then go looking for psychological treatment. And this was in the 70s, and immediately were being medicated and having some heavy duty pathological diagnosis dropped on into their idea of who they were, when their day-to-day life before that was very adaptive and very spiritual and very artistic and all these other kinds of things that showed openness to experience. But there was no way at that point for a lot of the folks in Chicago, in terms of their training, to see that as being a plus or being some other kind of human condition that was not necessarily going to be a problem, and we got interested in Christine Simmons Moore's work on schizotypy, coming out of Claridge's questionnaire on schizotypy, where you could see that people with these kinds of experiences might have a couple of questions answered the same way as someone who was having a problem with mental illness, but they weren't diagnosable. They weren't even close. So it was it's kind of wonderful to see, especially in these really kind of, you can't miss these kinds of experiences. They kind of hit you in the head. So even with that kind of an experiential sort of surround, it's still possible to say, wait a second, we can work with this, and this is not something that has to be medicated away.
Exactly.
Really wonderful. Well, does anybody else have any questions? I have seen a lot of thank yous, and Ursula was saying, thank you for the presentation. It's so important. Often my clients talk about this traumatic experiences from a past time of isolation. The emotions of these periods are the cause of some physical changes in the body. So I think people are very happy with what you did today.
Thank you very much. And thank you so much for the opportunity truly to be able to share. And I think it's important that we do have opportunities to share this. So thank you to you, especially Nan, and to Brian for organizing all of this, and to all of you who showed up, and to those who are coming on demand at later times. Thank you.
Yeah, to watch the videos for sure. Well, it's just been wonderful, and we're at the 2-hour mark.
Yes.
So if you don't mind, I'm going to share that last slide and tell everybody what's happening tomorrow. Let me get this up here. So I'd like to let everybody know that tomorrow at 1 p.m. Central, we will have Rosemary Pilkington from Staten Island, who will talk about the Gilbert Roller and the Bindeloff case. This was a group of young men back in the 1920s, including Montague Ullman, if you remember him, a very famous psychoanalyst and psychiatrist, very much interested in parapsychology. This young group of folks wanted to see what all this seance stuff was about. Rosemary wrote a wonderful book called The Spirit of Dr. Bindeloff, The Enigma of Seance Phenomena, that was published in 2006. And she's going to come back and talk about that case and what she learned from it in her talk tomorrow. I just want to say a little bit about her. She was interested in psychic phenomena since childhood, when she heard family stories of unexplained visions and strange happenings. As a young adult, she immersed herself in articles, books, and journals on the subject, and attended seminars and lectures at the American Society for Psychical Research in New York. She has a BA in music and MS Ed. And under the mentorship of a world-renowned psychologist and parapsychologist, who many of you might know, Dr. Stanley Krippner, she earned her PhD in psychology in the Consciousness Studies program at Saybrook Graduate Institute before it became a university. She did her dissertation on children's ESP. She's presented her results of her experiment to the Parapsychological Association, and she's an associate member there. She has imparted what she has learned and experienced to others by teaching classes in parapsychology and alternate healing methods, by lecturing and by writing. She was a consulting editor for the newsletter Mind and Medicine and has written book reviews and articles for publication as varied as Fate Magazine, the Journal of the American Society for Psychical Research, and the Journal of Scientific Exploration. The other thing she's done that we're all grateful for are her books, Men and Women of Parapsychology, Personal Reflections. So I just wanted to let you know what was coming up and to invite you all to come along, and all of you who came only to see Dr. Hedva, we will be sending out another newsletter on Monday, which I hope will have the YouTube video thing there, and some more information as well about a Parapsychological Association event that's coming up that is dealing with exceptional experiences that I think you guys might be interested in. Well, thank you for coming, and thank you, Beth, and have a wonderful day, everybody, and we'll see you tomorrow, I hope. Bye-bye.